Minimally invasive laparoscopic surgery has been around for 20 years, helping to provide relief to patients by limiting large incisions and strenuous surgeries. But there are limitations to laparoscopic surgery. Some procedures may be too complicated.
You would have to then say, got to make a bigger incision, get my hands inside to be more definitive.
Building on the principles of laparoscopic surgery, surgeons of all specialties at St. David's North Austin Medical Center are now using Intuitive Surgical's Da Vinci Robotics surgical system. It's used to perform traditional surgeries as minimally invasive procedures.
One of the other leaps of technology was the introduction of robotic laparoscopic surgery, and now what that does is all of the instruments now move just like your hand does. So it moves, it basically has a wrist, opens, closes, rotates, etc. So it basically miniaturizes the surgeon's hands to do the same surgery they would in a minimally invasive fashion.
The Da Vinci works by inserting small surgical instruments through tiny incisions in the patient. These instruments are maneuvered by robotic arms that are controlled by the doctor who sits at a console.
I hold a master control and I rotate it as I desire. And basically every motion I make is recreated inside the abdominal cavity.
And the ability to get into almost superhuman articulation of your wristed movements is very natural and easy.
Along with the advanced maneuverability of the instruments, the Da Vinci system also enhances the doctor's view inside the patient, helping to increase the accuracy of the procedure.
It enhances the capabilities of the surgeon. So if I can see normally like I am right now, now I can see in high definition, and beyond that I can see in a magnified view.
The advanced vision and minimally invasive nature of the surgeries helps reduce patient trauma, which leads to less time in the hospital, as well as less pain, less medication, and less recovery time for the patient.
A 3 or 4 day stay gets turned into an overnight stay, and the recovery is a couple weeks from work instead of 4 weeks from work.
To be able to get a shorter post-operative stay, to get back to work within sometimes days, much less 1 to 2 weeks, versus an 8-week out of work recovery phase for the majority of these surgeries that would be done open or through a large incision.
St. David's North Austin Medical Center is reaffirming its commitment to bringing state-of-the-art, minimally invasive surgical procedures to the residents of Central Texas.